So starting off, describe your career, education, and career path. So I was born here in Winnipeg at St. Boniface Hospital. I grew up in Dryden, Ontario. It's a small community about 3.5 hours east of here. So we didn't get the opportunity to go to career symposiums. So when I graduated from high school, I took the advice of my physics teacher and went into engineering because I had a strong background in math and sciences. I graduated in 2003 from University of Regina, and I went to work in Thunder Bay as an electrical engineer at a utility company. So I worked there for a few years, and although I got to apply my math and sciences, I wanted to help people, and I didn't really feel like I was doing that at my job at a desk all day. So I started volunteering in a hospital, and during that time, I decided that I wanted a career in healthcare. So I went to Calgary and attended SAIT in nuclear medicine technology. So I was there for about 8 months, and then I came to Winnipeg and I did my clinical practicum for a year. I graduated from nuclear medicine technology in 2008, and I began working at the Grace Hospital and Health Sciences Center here in Winnipeg. I went on to work as a senior technologist and radiation safety officer at a small community hospital in Sarnia, Ontario. And then recently I came back to Winnipeg, and now I work with our radiation safety program. So what are the daily routines and responsibilities of a nuke med tech? Is every day the same, or is there a lot of variety? And how much of your day is spent working with other people? When I say I'm a nuclear medicine tech, most people tend to think that I'm a doctor or a nurse, that I build nuclear warheads, wear a hazmat suit, or I take x-rays. And that is not the case. So nuclear medicine technologists, we are medical radiation technologists. We fall under the same group as x-ray techs, radiation therapists, and MRI technologists. And if we think about diagnostic imaging, we can throw ultrasound in there as well. But nuclear medicine is a separate entity. So what we do in nuclear medicine is we use what's called radiopharmaceuticals to evaluate the function of specific organs for diagnosis, treatment, and management of disease. There's over 50 different types of clinical procedures that we become competent in, and every day we work with healthcare professionals and we provide care for patients of all ages. So what that really means is we kind of look like nurses. We wear lab coats and scrubs. We administer these radiopharmaceuticals to patients typically in the form of an injection. We inject into a vein typically. We do some tests where we would administer it by the patient breathing it in, or we mix it in with some food and give it to the patient. Our patients can be babies from the ICU all the way to the elderly, and we image them under what's called a gamma camera. So it's similar to an X-ray, but it's a gamma ray that we're looking at. So in nuclear medicine, we image almost all the organs. There's a particular emphasis, I'd say, on cardiac imaging and skeletal imaging, but we look at the lungs, biliary, GI system as well. As mentioned before, we use a gamma camera, so this is what it looks like. We lay the patient down on what's called the table here, and they move into this gantry, this donut-shaped thing. And these two boxes, what we call the heads, move in really close to the patient, so it's within inches of the patient. And it detects the radiation from that radiopharmaceutical coming out of the patient, and it's detected on the camera. So that's how we get our pictures. So what do our pictures look like? This is a bone scan that we've done for a patient. On the left, I would say this is a normal bone scan, and on the right, this is a bone scan of a patient that has had prostate cancer that spread to the bone. So these patients were injected with what's called a phosphate compound. So part of that pharmaceutical is radioactive, and part of it is a phosphate. So the bones take up phosphate. It doesn't really care whether or not it's radioactive. And we can see in the patient that has prostate cancer that some of those bones are taking up the phosphate a lot more than the normal bone. We can see that by the dark spots on the scan. So sometimes this stuff doesn't show up right away on an X-ray or a CT, because our scan is a bit more sensitive for it, so patients will come and see us in nuclear medicine too. So this is what's called a renogram. So we've injected a patient with a radiopharmaceutical that's designed to go to the kidneys. Gets taken up by the two kidneys here, and empties out into the bladder. So as you can see, our picture here is running at about 27 minutes. It's kind of blurry. We spend more time with our patients. We're not an X-ray department churning out patients every 15 minutes. Some of our patients we image for 5 minutes, half an hour. Sometimes we see them later on in the day or the following day. So it's a little bit different of a relationship we have with our patients we see throughout the day. And this is a cardiac image. So this is kind of the bread and butter of nuclear medicine. We do lots of these a day. And this is the heart. I know it doesn't really look like the heart. It's actually just the left ventricle. And we've taken a three-dimensional picture of it. So we've sliced it this way, and this way. So it should look like a donut and a U shape. This patient had what we call a stress test. So they were put on a treadmill or given a drug to stress their heart. We inject them with the radiopharmaceutical that should go to the heart muscle. And then we've done it again with the patient in rest condition. So as you can see, part of this patient's heart muscle is missing. So either there was a chunk of plaque in there or the heart isn't working anymore because of a heart attack. And we can evaluate that on our tests. So this is a test we commonly do in nuclear medicine as well. So as a technologist, we make the radiopharmaceuticals, we talk to the patient, we explain the procedure, we take the images, we process the images, and then that information goes to a doctor. And the doctor looks at these images and writes a report that goes to the patient's physician who requested the test. So we aren't involved in giving the patient bad news or anything like that. That is the doctor's job. Okay, so what are the working conditions, the benefits, your salary scale, hours of work? Do you have to travel or work evenings and weekends? In nuclear medicine, we typically work 8 to 4, Monday to Friday. We may work some evenings and weekends on call, and that's just for emergency type tests. The reason why we only work 8 to 4, Monday to Friday is because the radiopharmaceuticals that we use, they have what's called a 6-hour half-life. They expire throughout the day, so we aren't making these round the clock. We typically work in large centers. So in Manitoba, we have nuclear medicine departments at Brandon General, Health Sciences Center, St. B, Seven Oaks, Grace, Victoria, and then there's 2 private clinics here in Winnipeg. Most nukes are unionized with the MAHCP, and we get benefits and a pension plan through HEP Manitoba. So this is our collective agreement from this year. So as you can see, we recently got a raise. Nuclear medicine technologist starting in the field starts at $33 an hour, and we top out around $38. You can see that we make exactly the same as an MRI technologist and an ultrasound tech. We make significantly more than an X-ray tech. And you can access this information on the MAHCP website if you're interested in looking at other healthcare professions as well. If you're a public employee in the province of Manitoba and you make more than $50,000 a year, your name and your title and your salary get published. So back in 2009, this was my first year as a nuclear medicine technologist, I made about $65,000 a year. In today's dollars, when we consider a 3% increase every year, I would be making about $74,000. Down here at the bottom are some of my fellow nukes. Senior nukes, they make around 86 to 96. The variance there is probably based on overtime and call. And a general duty nuke med tech at the top of their pay scale is about $81,000 a year. Just want to point out, here's some nursing salaries, and compared to mine in 2009, I'm somewhere in the middle. It's hard to tell from this report how many hours these nurses are working, but you can see them ranging from $51,000 to $97,000. And my guess is the nurse making $97,000 a year is probably working a much longer standard work week than me at 37 and a half hours. As mentioned before, the X-ray tech makes less than us. And just a bit of food for thought, these 2 resident year 2 and year 4, these are doctors. So they're doctors that have been in school for a 4-year of undergrad, 4-year of medical school, and they're just in their residency. So they're in their 10th and 12th year of their training respectively, and still making less than we do. Now, granted, when you actually become a doctor, you do make a significant amount of money, but you have to keep in mind how many hours these folks are working. So We'd like to say in nuclear medicine that we have a nice balance of work life and then home life. Okay, so on to the stuff that's more like mundane and unpleasant working conditions and what do I dislike about my job. So working in radiation with radioactivity, we're highly regulated, and also working in healthcare, there's a lot of paperwork. So there's a lot of documentation that you have to keep track of during the course of your workday. We work in a hospital, so we work around sick people. So some patients are coming down and they're not feeling very well and they need to use one of these guys. They can be coming from the ICU. They have tubes coming out of them, chest tubes, catheters, breathing tubes. And then in nuclear medicine, about 99% of the patients, we inject them. So you have to be okay around needles and blood because that's what we deal with all day. The next one I have here is a little lady lifting some weights. When we work with radioactivity, we work with lead. So our doses come in these little pots that are kind of heavy. But I'd say most of the heavy lifting we do these days are patients. So patients come down, they need help getting from the wheelchair to the table, or from the stretcher to the table. You have to position their legs or their arms, and they could be completely immobile. And so that's where most of the heavy lifting, I think, comes in throughout the day when you're working with patients. And lastly, I put a picture of feet on there. Coming up to summer, you've got people coming in with their sweaty feet in their shoes, and you have to position their feet for bone scans, and this is one of the personal things that I disliked about my job, but not everyone feels that way. So if you're thinking about going into nuclear medicine, what type of education and employment experience do you need? So in Manitoba, you need to be registered with the Canadian Association of Medical Radiation Technologists and with the Manitoba Association of Medical Radiation Technologists. So I'll just give you a couple of seconds to jot down those websites because you can find out more information about the programs, about our modality in nuclear medicine, and about the other modalities as well, like X-ray and MRI. So how do you get registered? Well, you have to successfully complete an accredited program, and you have to pass a national competency exam. So for nuclear medicine, there's 6 programs in Canada. I only have 5 listed because one of them's in French, and I didn't think anyone would be interested in it. So starting, sorry for French people, starting on the West Coast is BCIT. They typically only accept residents from BC. So if you want to move to BC, establish your residency, and then apply, go ahead. SAIT is in Calgary. That's where I went to school. We do 8 months of school in Calgary, you get 2 months off, and then you can do a year of your clinical practicum here in Winnipeg, and you graduate with a 2-year diploma. The Michener Institute is affiliated with the University of Toronto. It is currently not accepting applicants into their 4-year degree program. It's currently on hold. Out on the East Coast is St. John Regional Hospital and Dalhousie University. I'm not really familiar with these programs. I do know that Dalhousie University is a 4-year degree program. So a bit about degree versus diploma. We get the same jobs, we're accredited the same, we make the same amount of money. It's kind of a personal choice whether or not you want to go to school for 2 years and start working in the field, or if you want to go to school for 4 years and start working in the field. You can take your degree and use it for other things if you want to go and get a master's or something like that. But with SAIT's 2-year diploma program, there are universities that will accept the 2-year diploma as transfer credit, and then you can work for another 2 years in university to get a Bachelor of Science. So there was a number of questions about qualities and abilities, what's needed for someone starting out, what do I need in my present position, what's necessary for the future. What type of experience do you need in other occupations, volunteer work, and then the procedures for hiring. So I'll just address the second point. Yes, I had an engineering degree when I went into this, but it wasn't necessary. All the programs mentioned on the previous slide, it is high school that's required for you to get into the program. Volunteering, I would strongly recommend. Part of the application process, they look at your marks and your prerequisites. There's also a questionnaire you need to fill out about the profession. And having volunteer experience, especially in the healthcare setting, gives you a stronger application. But it's also important for you folks to know if you even want to work in healthcare and whether this is the right career for you. So with the other points, this is a job posting from the WRHA website for a nuke med tech. I believe it was a casual position at the Grace. I'm not going to go through the whole thing. I'm just going to touch on some important topics. So your ability to interact effectively and excellent communication skills is critical in this job because every day you're talking with ward clerks, secretaries, nurses, physicians, other technologists, and you need to be able to convey to those people information about your patient. And this could be critical for their diagnosis. It's also important to have those excellent communication skills when you're talking to the patient and the patient's family, because you have to explain the procedure and you have to answer all of their questions. And if you don't give them the right information, they might not follow the instructions properly, and then you can't do your test. Nuclear medicine is a really busy department, so you have to have strong organization and time management skills. Typically, we're injecting all these patients in the morning. They're coming back at 5 minutes, 15 minutes, half an hour, 3 hours. So you have to be able to stay on schedule. It's really important because the diagnosis can depend on it. If you're supposed to image a patient at 15 minutes and you took too long at coffee and you image them at half an hour, the results may be completely off. And it's also important because patients tend to complain when you keep them waiting in the waiting room too long because you're behind schedule. The ability to adapt, I think, is inherent in all settings in healthcare. You have patients that are coming in and things change throughout the course of the day. You could be ready to go for lunch and your senior tech tells you, no, you have to do a lung scan. So you have to be able to adapt to the changes that you'll see in a healthcare setting. A bit about physical demands and working conditions. Physical demands I talked about earlier with the heavy lifting. Mental health, you work in a healthcare setting. Our patients are sick. Some of them are at the end of life care. They're experiencing changes in their well-being, and some of that comes out when they see you. So they're looking at you for emotional support, and that can be hard on yourself. So you need to make sure that you have strong mental health, both in and out of work, because you can take this home with you at the end of the day. Some warnings, you may be exposed to radiation. Well, you will be exposed to radiation. You are working with radioactivity, and you're working with radioactive patients. But the key thing is that it's within acceptable limits. And that's because there's people like me that work in radiation safety that ensure that your doses are kept within limits. The other things is extreme client injuries, occasionally working extended hours, infectious diseases, blood, body fluids. Like, this is par for the course working in healthcare. So this stuff seems really scary to you. Although we are trained, this might not be the right career for you. So opportunities for other positions or advancements. Depending on what hospital you work in, we have these different titles, a senior charge or chief technologist. These folks typically work part of their day with patients, and then part of their day is doing staffing, scheduling, meetings, acquiring new equipment, that sort of thing. Management is typically non-clinical, so you aren't working with patients anymore, and you could be managing a nuclear medicine department in a larger facility, or a diagnostic imaging department, or a department within the healthcare setting. Radiation safety is the area that I work in. So we are highly regulated by a federal regulator called the Canadian Nuclear Safety Commission. We need licenses to operate our nuclear medicine departments, and everyone needs to be trained in those departments on the policies and procedures with respect to radiation safety. So that's a full-time job, just keeping that working. And other opportunities can be in non-clinical roles such as quality control, instrumentation, and research. So what changes have I seen in the past 5 years, and what do I expect in the next 5 years? I did work on a camera that looked something like this. This is what we call an old single-head camera. It was old hardware, old software. You can only take one view of it at a time of a patient, and the pictures weren't, easy to process or easy to work with. What we're seeing today is cameras like this. So this is what we call a SPECT-CT camera. It has 2 heads, so we can take 2 views at the same time. It can rotate around the patient in a circle, doing a 3-dimensional view, And it also has a CT component built into it. So we take CTs as well, but they're not for diagnostic purposes. So we aren't replacing CT here. I can give you an example of where we would use this. This is a bone scan of a patient that I did some time ago. And they have this huge mass in the middle of their leg, and it's really hard to tell whether or not that's in the front or the back of the leg. So doing a three-dimensional picture with CT, this is just what I'd call the axial slice. So you take the leg and you slice it this way. The grayscale picture is your CT. That colorful blob is the nuclear medicine stuff. So you can see that this is at the back part of the leg, and this is going to greatly affect how the surgeon's going to operate on the patient. Without the CT in there, you wouldn't really know where it is. It would just be this kind of colorful blob floating in the middle of there. So it really helps the physicians with their diagnosis. And what we're seeing in the future is nuclear medicine imaging being fused with MRI. So demand for workers increasing or decreasing, I'm not too sure I'm the best person to ask. But I can tell you that in Manitoba, along with the rest of the country, we have this population called the baby boomers, and they're set to retire. And we also have an aging population in Canada. So our waiting rooms are starting to look like this. And we can tell in our healthcare setting today that doctors are relying more and more on diagnostics. It's pretty rare that you go into your doctor's office, they do a physical examination, and they know exactly what's wrong with you. You're going for blood work, you're going for CTs, MRIs, X-rays, and you're going for nuclear medicine tests. And there's no silver bullet when it comes to diagnostics. It's not like you go to MRI and poof, they know exactly what's wrong with you. We all work together to give the information to the doctors so that they can diagnose you. And this is being relied more and more upon in the days to come. So what advice do I have for you folks? Well, I'm sure you've all heard that pursuing a career is a significant investment of time and money. We all know about students that graduate with $40,000 to $60,000 in debt, and they're starting work with $40,000 a year salary. So nuclear medicine sounds pretty good. You can go to school for 2 years and start at 70 grand a year. However, you have to make sure that this career matches your goals and values, and you have to realistically assess your strengths and weaknesses. So if you don't like working with people and you're afraid of blood and needles, nuclear medicine is not for you. But if you have an interest of working with technology in the healthcare setting, then this could be a great career for you. And in order for you to really determine that, I'd suggest doing a job shadow, and you can spend half a day or a full day with a nuclear medicine technologist, seeing what we do in the field. And if you stop by the booth later on today, or after this session, we can sign you up to talk to our clinical instructor who can arrange this for you. Okay, wrapping it up. Why did I choose this occupation? Well, as I mentioned before, I was an engineer. I liked working with technology, but I also wanted to help people. And when it comes to diagnostic imaging, nuclear medicine was more appealing to me. I mean, it had a regular work schedule. I didn't have to deal with patients dying on the table, which is kind of the case in some of the other modalities. So it was the right amount of excitement in my job, and I got to work with people and technology. So why am I still in it? It's because I like to do what I do.